We need to be able to change with what our community expects, what our officers are experiencing. Where someone loses their life.
The new IMPD chief is creating a new bureau and a position on his command staff to address the department's response to mental health calls.
Chief Chris Bailey believes the Operations Support Bureau will modernize operations in his department and also collaborate with mental health resources.
Rich Nye sat down with the chief to talk about the move he hopes will benefit the community and officers.
Herman Whitfield III suffered a mental health crisis in his home in April 2022. He died in police custody after being tasered twice and restrained on his stomach. Last August, Kendall Gilbert held a machete in front of his house for hours during a mental health crisis standoff with police before he allegedly rushed at officers and was shot and killed.
Very few incidents, one or two, where things don't go as anybody wants, including the police, where someone loses their life or is severely injured as a result of that. We don't want that to happen. Even though it happens very rarely, and our officers do it right a majority of the time, we want to get to the point where it's zero, where we don't have any bad things that happen as a result of someone with a known mental health condition.
So IMPD Chief Chris Bailey is creating the Operations Support Bureau, led by Major Tabitha McLemore, to better integrate mental health resources into police response. Chief Bailey says that unless there is violence or a threat of violence, police may not need to respond to a call. So getting the right information at the time of the 911 call is critical to this issue.
We want our officers to respond in the appropriate way. So do we have enough training? Do we need to change our training as part of that? How can we spread the word of 988 so that people know that there's another option for them to call other than 911?
There is an initiative to make sure that the dispatchers are being trained where they can know the correct decision tree to follow to ensure that when an individual is calling 911, we know what the appropriate route is for response.
The new bureau will work with the Mobile Crisis Assistance Team and the clinician-led community response team to prioritize mental health incident response. In Indianapolis, Rich Nye, 13 News.
Chief Bailey stresses that in the past 2 years, IMPD officers have responded to over 7,000 calls to someone in severe mental crisis, and they've taken them safely to get help.